Okay, so today we will be doing a quick discussion, not a discussion, rather we will be quickly discussing the algorithm for urethral injury. So how is the patient going to present? The patient won't be able to void definitely because the outflow tract is injured, so the urine would accumulate into the bladder. Because of that, bladder will be palpable. So whenever you receive a patient who has this complaint of urinary retention, specifically acute urinary retention, always consider a differential of urethral injury in your mind, especially if the patient has come as a case of road traffic accident or any other injury. So in that case, attempt a few gentle catheterizations. And if you're unable to pass the Foley's catheter, never force the Foley's catheter into the patient, because in that case, you're going to create a false passageway. Okay, the urethra would be, further damaged because of catheterization, and you would have to, do a surgical repair of the patient later, and which would create a lot of complications. So, always attempt gentle catheterization. If they fail, go for a suprapubic cystostomy. Okay, always. Never, try to force a Foley's catheter into the urethra. Never do that. Now, whether the anterior urethra is damaged or the posterior urethra is damaged, we are just going to discuss that. So the anterior urethra mainly has two portions, the penile part and a bulbar part. Okay, the penile part is going to be damaged whenever there's a crushing injury, and where the urine is going to be accumulating depends on whether the Buck's fascia is intact or whether it has ruptured. Don't mind the rooster in the background. So if it is intact, the urine would be it would be accumulating around the shaft, and if it has torn, then it would accumulate into four places: the superficial perineal pouch, scrotum, shaft, and in the anti-abdominal wall and the upper thigh. Okay. Now, if the bulbar part of the urethra is damaged, then what would be the history? Mostly, it would be a straddle injury. And when does it occur? When the person was riding a bicycle and had an accident, or riding a motorbike, or riding a horse. A straddle injury is like a typical scenario for bulbar urethral injury. And there's going to be a triad. Okay, there would be blood in the external meatus on examination of the patient. The patient would be unable to void, that would be the complaint. And there would be perineal bruising. The perineal region would be bruised or have a hematoma on the clinical examination of the patient. Inspection, you would see that on inspection. So what would happen when this triad is present and a straddle injury is present and bulbar urethra has injured? The urine would accumulate in the same four places as it was in case of a ruptured Buck's fascia: superficial perineal pouch, scrotum, shaft, and the anti-abdominal wall and the upper thigh. Now, let's talk about the injuries of the posterior urethra. So we know that posterior urethra includes the prostatic part and the membranous part. The prostatic part is not that important when we're considering the injuries. The main focus is membranous part, and it's very important. Why? Because this is associated with a pelvic fracture. Always remember that this is an MCQ point also, that whenever a patient comes to you with pelvic fracture, always keep in mind that there can be an injury of the membranous urethra, and never ever attempt a forceful Foley's catheterization, because in that case a patient with pelvic fracture is very likely to have a membranous urethral injury. Okay, and this can happen in high speed traffic accidents. And one more correlated with pelvic fracture is the chance of excessive blood loss and hemorrhagic shock. So you always have to control the blood loss also, because it can be more than 2 liters. Okay, so there can be a pelvic fracture with it. You're also going to see whether the puboprostatic ligament is intact or not. For that, you're going to try to examine the prostate with a DRE. And if you cannot feel the prostate, it's not palpable, you cannot feel any lobe, then this means that the ligament is disrupted and it has kind of dislocated a little bit. And then you're also going to see whether the perineal membrane is intact or not. What is the significance of it? Let's see. So whenever the membranous urethra gets damaged, where is going to be the accumulation of urine? This is very important. It is going to accumulate into two places: the retropubic space of Retzius, which is also known as the paravasicus space, and in the deep perineal pouch. These are the two places where it is always going to accumulate if the membranous urethra is damaged. But if the perineal membrane has also ruptured, along with this, the urine is also going to seep into the superficial perineal pouch. Okay, so this is an extra space for urinary accumulation if the perineal membrane is also ruptured. That's why we were also considering in our mind whether the perineal membrane is intact or not.